How's it going, guys? This is Dr. Tyler from the Doctors of Physical Therapy. Today we're going to go over a median nerve glide. So there's going to be two versions I'm going to show you. One's going to be a little more intense and one's going to be a little easier. Depending on what you've discussed with your physical therapist, you're probably going to do one or the other. Now let's start with the easier one. The easier one is called a slider. So what you're going to do is your palm's going to be rolled in and down. Your head is going to be starting from the opposite way, side bending. Now what you're going to do is when I straighten my arm and my hand goes down, my head is going to follow in that same direction. I'm going to keep my eyes looking forward. You're going to hold for a second or two at most. At the very end, what you should feel is just a little bit of tension down the arm, but it shouldn't be a ton of pain. And then you come right back as the palm curls in, my head goes the other way. And again, I'm going with my head and my arm at the same time. My palm goes down. I should just feel a little tension down the arm, hold for just a couple seconds, and then come right back. Now that's the easier version. Now the harder version, which would be called a tensioner. The difference on this one, what you're going to do is instead of your head starting this way, you're going to have your head starting towards your hand when your hand is curled, and when my head side bends, my hand is going to go this way. So now it's opposite way for the arm and the head. I'm going to hold for just a couple seconds again, and then come back with my head and my arm at the same time. And one more time, head out, palm down, hold for a couple seconds, and then come back. Now the most important thing for this one is it's not something like a hamstring stretch. This is stretching and getting a little bit of gliding in that nerve, better in that tissue. So we want to really make sure we're not holding it longer than just a couple seconds. It's not something where we want to hold on to this end position for 30 seconds to a minute, especially if we're already feeling symptoms down kind of those like middle fingers, which is probably the reason why you're doing this exercise. So discuss with your physical therapist on the dosing and everything, but that is how you do a median nerve tensioner and slider.